So, hello, I'm Lauren. I am the senior charge midwife and sonographer all the way up in the Orkney Islands. So the bit of background. NHS Orkney is the smallest health board in Scotland. We are obviously in a very remote and rural location, and that can pose really unique challenges for us. And within the first 72 hours of life, our local midwives now perform examination of the newborn. If a problem with a newborn hip is suspected, or if there are any risk factors present, then that means that family has to currently go down to Aberdeen Sick Kids Hospital within 2 to 6 weeks to have the baby's hip scanned. That involves a 148-mile round trip, usually by plane, taking on average more than 12 hours for basically a 10 to 15-minute appointment. There are often weather-related delays, and parents report that it's highly stressful and inconvenient for them. So our aim was to set up the newborn hip ultrasound screening service locally, eliminating the needs for families to travel to Aberdeen, and that was ultimately going to ensure that the care is both equitable and sustainable, whilst also benefiting the environment and obviously enhancing patient experience as well. So the motivation. So this was first back in March 2019. This is my second daughter in these photos. So I was on the plane to Aberdeen and I looked around and there were 4 babies and 7 adults going away for a hip screening. And I thought, this is absolutely madness that we can't have this service locally. It was very stressful for us all. And obviously you can see my little Arwen needed to have her hips treated. I was currently doing the sonography training at the time, and I thought this is a skill I could probably learn. And then that got my brain thinking, what can I do to help, and how can we do this? How could I kind of implement this within NHS Orkney? And then I'm very much, when one door closes, another one opens. So in 2022, I'd been qualified a couple of years as a sonographer, and the hospital came up with a bright ideas, quality improvement, cost saving measures. I put across this point, and the project was put on hold due to financial pressures within the board. However, as I say, when one door closes, the other one opens. We were successful in our bid for the Green Maternity Challenge, which is great. And we've been able to kind of go down this avenue, and it's given us a bit more leverage with the board. I quickly realised that it was not going to be a quick fix. Introducing a new service it takes quite a lot of time, and obviously was going to take longer than the 16 weeks we had in the Green Maternity project. So we had to speak to lots of different people, and I think one of the most important parts was the patient experience questionnaire. We received so many responses for such a small area, and it's given us, the patient voice has given us quite a lot of leverage as well. So 80% of the families experienced a degree of stress. 98% of the respondents said that access to an appointment locally would have been much more preferable. And 88% said that it was somewhat or very important to them that the NHS considers and reduces environmental impact. And I think, our project very much aims to do that. So yeah, as I said, Rome was not built in a day. That was very early on that I realised we wouldn't be able to have a finished case within the 16-week. So it's very much a work in progress. And we have many pieces of puzzle to complete, and obviously time is a major factor into that. So next steps, so we had to set up honorary contracts, which take quite a long time, I've realised, with Aberdeen. And this is going to allow the sonographers to spend some time in Aberdeen at the Royal Aberdeen Children's Hospital ultrasound department, just to get a feel for whether we feel it's something that we will be able to do. And then in June and July, there is a 2-day course in Cardiff on the actual hip ultrasound itself that we will obviously aim to go to. And then hopefully by the end of the year, we will have the service fully implemented, which will just be great. So obviously these are all very much hypothetical, but economic sustainability, patient outcomes, and environmental sustainability is kind of the main aim here, which will in turn it'll I've lost my words, sorry. It will equal the equitable sustainable healthcare. So reduction of £15,000 saving in the first year and then going forward, that annual saving will increase to £17,000 per year for the health board. Anecdotal feedback suggests that families are more satisfied with the convenience of local services, reduced travel times, and the ability to remain close to home for care should contribute to a more positive overall healthcare experience. We know that. And you can see that our carbon footprint reduction is quite a lot of miles that we're going to reduce, which is great, and also will have a saving of 7,500. So to conclude, patient feedback obviously shows that strong preference for the local service. And I have figured that introducing a new service, particularly in a remote and rural setting, we need patience, perseverance, and lots of ongoing adaptations. We need to have that clear end goal, and we need to stay adaptable in our approach. And then hopefully our overall aim is to be able to deliver greener, more efficient maternity services, benefiting both the environment and our patients in Orkney. Thank you. That's a whistle-stop tour.
Thanks so much, Lauren. Any questions from the judging panel? Lauren, are you okay just to stop screen sharing?
Yeah.
I have a question. Lauren, I was really struck by what you said about how the huge barriers you were encountering and how the project was paused, and then how participation in the challenge unblocked that. And I wondered whether you think that was just because it was part of a more visible thing, or was it partly the connection to the environmental agenda? Yeah, and generally any insights you might have on changes that we could make nationally or support through the colleges and things that might help with making this sort of project easier in the future?
Yeah, it's a good question. I certainly think it's probably a bit of both. They probably thought, ooh, green maternity, that's really good, let's go for that. And also having the backing of an actual project, I think has been really helpful. The board basically prioritized, they prioritized the list of their bright ideas, and obviously they didn't pick our one, but then I was a bit embarrassed to go and say, well, actually we've won this project now, so can we go ahead with it, please? So they were like, yes, no problem. So I do think it really helped.
Lauren, if I could ask you a question. Nice presentation. You said you didn't have support initially, and obviously this project helped you. Will you have support in future with this project? Have they agreed to give you support?
Yes, definitely. We've gone down another route slightly as well, in the fact that we've said, as part of the Best Start maternity pathway, remote and rural midwives have to spend 1 week off island every year at a tertiary centre. So we have said that the sonographers will go and spend time in the HIP department in Aberdeen to keep skills up, maintain skills, network, and just build better relationships with the team in Aberdeen, because we will have to link very closely with them. So they're very much agreeable to it. Yeah.
Thank you.